So let's talk strength and recovering from an injury. One of the easiest things to tell somebody when they get injured, or maybe they're asking or looking into how they can prevent injury, is to say, just get stronger. And I used to think that was pretty much the answer to anything. The issue is when you actually start working with people in pain, when you start working with people with complex cases, um, it's not that simple. And if only, it were that simple. Just get stronger and you won't be in pain. But then you got to ask yourself, are there people who are very strong and are still in pain? And if strength was the answer, why is that the case? And again, it's complicated and it really depends, meaning that there's a lot of things that kind of come into play when it comes to helping somebody get out of pain, manage pain, or whether they're in pain or not and still managing an injury. Sometimes pain isn't really the main limiting factor. Regardless, it's not that simple. And one of the things that kind of sticks out to me is that strength is primarily a very important intervention to incorporate into a rehab program, because more often than not, people aren't really doing it to begin with. So that's an important consideration to keep in mind. Now, you might think, I got better, or a patient got better after I got stronger. Therefore, the issue was that I was too weak. Again, that's not necessarily the case, because you can get better from a pain perspective or from an injury and have no changes in levels of actual force output. And then not to mention, like, strength is really dependent and specific to how you measure it. So there's this whole nuance to that in and of itself as well. And without getting too deep into it, just know that obviously, it's not that strength is going to solve all your problems. So don't be surprised when you just get stronger and stronger and stronger and you're still not really improving. If that's the case, there might be some other things you might want to consider in regards to like how you're approaching your rehab. And so I think that's an important topic to talk about, because it's just like the knee-jerk reaction or answer to somebody who's asking and looking for some guidance and direction. It's like, oh yeah, just get stronger. Oh, your back hurts? Just get your abs stronger. That'll solve it, right? Well, you know how many people I've dealt with that have, do core 4 or 5 days a week and still have back pain? Arguably, their core is a lot stronger than mine, but I don't have as much back pain. And I think it's important to consider, again, as somebody, whether you're a patient or whether you're a trainer working with these kinds of clients, it's not that simple. Now, the value in strength training comes in you building or kind of raising the floor of function. And I have seen strength be very valuable in overcoming chronic pain because of the process you engage in when you're trying to get stronger. Now, it's something that's hard to measure and track in regards to the direct relationship, but if you're going to rehab an injury and time is going to do a lot of the work for the most part, you might as well get strong in that period. And I think that's where the value comes in. And like I said, most people don't really engage in a formal strength training program, and if physical therapy is their first entry point to doing that, why wouldn't I incorporate that? And so that's why strength is something that's so incorporated into the rehab process. And it's not because it's going to solve everything, but rather it tends to be a very good vehicle for making progress in a lot of areas. Whether it be autonomy, somebody running themselves through a program, which is going to influence their level of or perception of control over their situation, especially if they're dealing with chronic pain. I'm going to get them on a strength training program. Are they going to get stronger? Hopefully, right? But they're also going to be able to run a program on their own and independently, which is going to be a very, very big factor in them feeling like they have control over the situation. Two, functionally, if strength allows them to do things that they otherwise couldn't because of their perception of their limitations, and strength is the thing that helps them better calibrate to what they can and can't do, then that's another reason to really incorporate that. Now, whether or not it changes pain, hard to say. It's not a one-to-one, but is it going to influence it? Absolutely. And sometimes, again, it's not because of the ability to exert more force, but rather somebody is better able to calibrate to their body, and that right there is enough to really change how they're perceiving pain in their body. But again, who doesn't like to get strong? And then number three, in regards to strength training, it's just a skill you're going to want to have the rest of your life. And again, people don't regularly engage in it, and so in my situation, or sorry, in my case as a provider, I'm often helping people learn the skills that they would want to incorporate long term, especially if they're considering working with a fitness professional. And so if I can impart that skill and the knowledge, or at least that introduction, hopefully I can make that transition to working with a coach in the future a lot easier, which is key because I was a coach prior to being a physical therapist, and you know, it sucks when patients feel like they're dependent on other people, or sorry, when clients feel like they're dependent on other people, or they're coming to you to seek answers, and the second they learn how to move, they feel confident incorporating program independently. They just have that much more ownership, autonomy, and just control overall of like how they feel they are moving their body. And I think that's just so valuable. And so again, if they feel more comfortable engaging in those things with a clinician, I think that's where I'm really grateful for my strength training background, because it allows me to kind of cook it into the process of rehab, just kind of expose them to positions, to movements, exercises that they're probably going to find themselves doing long term. And then if I say, hey, listen, I don't need to see you anymore, you just need to put in work. Like, I recommend working with this coach or trainer that I collaborate with. It's just such an easier conversation to have, and the value is there. The patients understand, and they know that they can still be very functional despite kind of still navigating an injury. And just knowing that they have a plan is enough. It's enough for them to completely change how they see their situation, how they're living in their own body, and it's also going to impact how they respond in the future when they're dealing with injuries, on their own, and maybe they don't have access to care as opposed to when they're seeing me, right? And so those are considerations to keep in mind regarding strength rehab and why it's so important and why it's so incorporated into the rehab process, but not for the reasons people usually say it is.